or www.fsa.usda.gov. The Farm Service Agency, serving all Americans.
The GOAT FM is WMOP Ocala, W261BA, WGGG Gainesville, and W221DX. The GOAT FM.
Fox Sports Trending now.
The PGA Championship is underway today in St. Louis, Belle Reve Country Club. It's the 100th PGA Championship. Ricky Fowler of the U.S., the first-round leader. He shot a 5 under 65, two-stroke advantage over a host of golfers tied for second place. That includes Jason Day, who shot 67. Justin Thomas of the U.S. shot 69. He's in the top 20. Tiger Woods and Rory McIlroy are tied for 36th place after shooting even par 70. Dustin Johnson just getting going, number one ranked in the world. He's 1 over par through his first 4 holes. Jordan Spieth, after the first hole, is 2 over. Phil Mickelson is tied for 95th place after an opening round 73, 3 over par. In daytime baseball, 3 games. Nationals 4-1 over the Braves, and the bottom of the 7th included. Bryce Harper did not start due to a sore leg. I'm Steve DeSager.
Hello, Cynthia Tieche here with Dr. Tieche. Our first official live show on Thursday at 3 p.m. on the GOAT FM.
Mm-hmm.
Yay.
I like it. I like our new time.
Facebook people have been watching us at this time for a while, but now we're on live on the radio at the same time instead of bright and early on Saturday mornings.
Yeah, I don't know how bright any of that was
No.
when we did that.
We were zombies. Yeah, I'm not exactly a morning person.
Yeah, that's an understatement. Since you slept through so many of my workouts.
I want to be a morning person. I'm a morning person at heart.
Yeah, at nighttime you're a morning person. And then at morning you're definitely not. You're a leave me the hell alone person.
Yeah.
All right, so what are you going to
help it.
talk about today? What exciting stuff has happened to us and, all of that? It's been a pretty hectic, exciting week.
Has it?
I think it's been busy and exciting. School's
Oh,
going
yeah.
back to school.
Yes.
For us,
we
our
had moms
kids.
coming in and doing cartwheels that their kids are finally back in school.
Yeah. Yeah.
I wasn't one of them. Maybe I was. No. I miss the kids when they go back. But it is nice to have structure and...
Quiet.
Yeah, I guess. I don't know. I still have you during the day.
Thank God.
So, I have lots of things that I wanted to talk about today. I have like a whole list, and apparently you do too, so we're going to be fighting for who's going to talk
That's
next.
okay. I'll just interrupt like I always do.
Yeah, he has some things that he wants to talk about today, but I guess he wouldn't tell me. He said, no, I'd have to be surprised with everyone else. He always does that stuff because he knows it's probably something that I'm not going to approve of.
And once
so
it's
he's
out
got to
there,
slip
and once
it
it's out there, it's out there. Yeah.
So we always get so busy talking about stuff that I forget to mention some things. So I'm going to start out with my end, since I never get to end with all of my info. We have a open house August 25th at the main recharge clinic on Southwest 17th Street. It will be from 10 a.m. to 2 p.m. We are always open on Saturdays from 9 to 12, or actually 8:30 to 12:30. But this open house specials will be from 10 to 2. We are still seeing regular patients that day, so it's going to be a little crazy because Saturdays are really crazy for us anyways. But I figured let's make it crazier and have some specials that day.
Why
so
not?
there is a Facebook event for our open house, or you can just swing by. Of course, we'll have some good cheese. We like cheese. I like cheese. I always get cheese. I mean food. We're going to have hors d'oeuvres, but yeah, cheese. It's going to be cheese since we're keto
And we
people.
know that you'll be whining, so we'll have plenty of wine and cheese.
Funny. So yeah, we're gonna have lots of fun specials. Oh yeah, I have some of the specials here actually on my little flyer. The Recharge IV will be $99, so people are gonna love that. Half off of all of our vitamin shots. So
Wow.
only that day. You can only come that day and get these specials, and you can buy a package for the future. But
So
yeah.
they can buy them half price.
You can buy them half
That's
price.
a pretty good deal for
It
people
is.
that are buying packages.
It's a darn good deal, especially these people who get these shots every week. So it saves them a lot of money.
It's like BOGO.
BOGO, yeah. BOGO. PRP facials will be $350, and I've got several people waiting for that special to happen because they love getting them, and that saves you $100. Half off of our mesotherapy, which is that targeted fat loss injections right into those like muffin top areas and those areas that no matter what you do you can't lose. Mesotherapy.
And
It's
it works
perfect.
great.
It does
We've been
work. We have
we've been
very
having
good results.
Great results with that, and it's not painful, and
No,
it's
it's
not
tolerable.
really that expensive.
Yep, it's tolerable. It's typically it's $300 for an area, but it's half off, so it'll be $150, and that's a great price. And you'll need several treatments, depending on what result you're looking for and what position you are in to start. But it's a great deal. Spider vein treatments, typically $300 for all of your legs, are going to be half off, so $150. That's a great deal. Botox, Dysport, $10. Always do that. $400 lip injections. We do a lot of lip injections. You're going to be doing a whole lot more because that is a really good price. And then our LED mask session, that'll be about half off as well. It's $20 for 20 minutes.
I like injecting lips. What I really like doing is the combination of doing filler, hyaluronic acid in lips, with putting a border of threads, the thread lift, and around the edge, the nice smooth threads, which adds a nice crisp line to people's lips. And we've been having some really good success with that, and people really like that. So that's going to be good that we can do the filler.
Yeah, a lot of people are going to be taking advantage of that, especially those first timers that are a little nervous. You know, it's not a cheap procedure, but it lasts a long time. We're talking like a year. So if you think, I mean, a lot of our lip injections are regularly $700. So, but that lasts a year. So it's not expensive if you realize like how long it's going to last. But never had it before. That's a good way to start with a $400 deal. So they're
Well,
like
and
it.
the thing is, it's one of those things that bothers people quite a bit, you know, and when you really talk to people, some people are very self-conscious about that, and it's something that always bothers them, so it gives them an opportunity to correct, you know, what they perceive as a flaw in themselves that they want to fix. I mean, some people just have no lips, you know. So.
Yeah. Yep. So we always offer free consultations, and we have that on our website, and people are pretty good about scheduling them. But if you're interested in weight loss or vitamin shots or IVs or hormones, and you don't even know where to start, like I want something for my face, but I don't know what, we do offer free consultations. The reason is because we know that you don't know. And so instead of coming in here and just, you know, not talking to you until you put down a lot of money, well, maybe you aren't sure which is going to be best for you. So we have highly trained staff to sit with you, talk with you, find out what it is that you want, and then point you in the right direction and say, okay, this is what you need for that. And then it's up to you what you want to do. So just remember, always free consultations at Recharge Clinic, because we know that, you know, this is a new thing probably for you, and you do need to get some more information without just paying right up front when you're not even sure what you want. I have a fun story that I want to talk about. Dr. Tieche might blush. So we like to consider ourselves old-fashioned, not because anyone's old, not that.
Well, you are, but you know.
I am extremely young, but we do like to consider our clinic old-fashioned because of the kind of care that we give. When you walk in there, it kind of feels like you're in your living room. We've got couches and chairs. Our staff tries extremely hard to be really friendly, remember your name, and just kind of, you know, make you feel comfortable. We've got coffee. I mean, we just really try to take it to a whole new level of service. But really, the old-fashioned medical care comes from Dr. Tieche, because it's not like your typical doctor's office visit where you're rushed in, rushed out. This doctor runs in, runs out. He sits at the computer screen while talking to you. I mean, he really spends a lot of time with whatever patient it is that he's seeing, and he does a great job. We do offer house calls, but not as often. We would prefer not to go out all the time because he is extremely busy, but we do, and we have. But today he had someone who honestly was ill and could not get out of their car. And so he did his first evaluation, guess what? In the car. Didn't you even draw his blood in the car?
I did.
Yeah.
I did a car call.
Yes. you know what? He couldn't get out of the car. He was ill. He had some issues going on, and that's what old-fashioned medical care is. It's not just, chop shop, in and out, get out of here. We don't really care. We really do care, and we do go the extra mile. And I just thought that was really cool that he did that. And I thought, well, you guys should know. He will go the extra mile to make sure that you get your care. So that was nice of you. Good job.
Yes.
I taught you well.
Great.
But we really do try to base our clinic on old-fashioned medical care. So you used to see the doctor, not the doctor's assistant when you needed something. Well, that's what you see here is the medical doctor, not just any other mid-level or anything like that. So it is really cool old-fashioned care. Let's see, what else I want to talk about before we go to break and then get into the juicy stuff. We're carrying a new line of products called ZO. I want to talk about that. You'll see, we'll post some pictures soon on our Facebook page. It is a skincare line by Dr. Zane Obaji. Dr. Obaji came up a while ago with the product line Obaji. If you're into your skin at all and you've tried to get some good skincare, you've probably heard of the line Obaji, and I love that line. And we do carry that. But Dr. Zane Obaji actually, left that original line that he made and made a new line, and so there's two. And the other one is called ZO for Zane Obaji. And it's really updated, really cool, great new products for anti-aging, rejuvenation, acne. They've got great acne lines on there. They have, for if you've got those spots, hydroquinone. Am I saying that right? Hydroquinone. Vitamin C. They've just got some really, really good products. It is medical grade. It is a prescription. You can only get it at a doctor's office. I picked that line because I know I like Dr. Obaji's products from his previous line, and these are just a little bit more updated. I'll still be carrying both lines, but I just got a bunch of really fun new things from ZO and some really good peels and what else? Masks on there. But, anyone who wants beautiful skin needs to remember something. There's no miracle. Nothing's going to happen overnight, not even with Botox and all of that. It requires commitment. It requires a good skin product line and just good care, good preventative care. And then when you have aged, reversing care. We need some of that too. So this line has everything, and it goes really great if you're getting Dysport or Botox or any of these other services that we're talking about. They complement each other really, really well. So we offer free consultations for skincare also, just to meet with one of our skin specialists to find out, well, what products do I need? I've got this issue or that issue, or I don't have any issues, but I want to prevent having issues. We have trained staff that will meet with you and point you in the right direction and let you know which product you should be using for your skin so that you can get and look the best and look 24 your whole life, right?
Yes.
Yeah. So we'll be having some specials on that this whole month on ZO. We have a few little care packages for those specials, and at our open house we'll have more specials on that line. Since we were talking about skin, and we jumped on that really quick, I want to talk about what people can do for these lines in their forehead. If you've got lines in your forehead, or those, it's called the glabella area, but right here between your eyebrows, or those crow's feet, it's actually not hard to get rid of. That's probably the easiest thing to fix. What do you think?
I would say it is.
Easiest, quick, that really is simple. We love having that because it's so, we can make you happy pretty quickly. And what that really requires, you want to go ahead and explain that?
So mostly what those lines are from kind of overactive muscles in your forehead and in this area here, your glabella area. And what's happening is they're actually causing the skin to fold over on itself just from the muscles being used. And most people use their forehead muscles quite a bit for a lot of expression. We use it when we're thinking a lot and, scowling, whatever the case may be. Those get used quite a bit. And so they kind of tend to show our age and wear and tear a little bit.
I just think you look exhausted.
Yeah. So what we do is, there's a couple of products that are put in that area, and those are called neuromodulators. And basically,
we're gonna come back to that.
Come back to those neuromodulators.
Yes, we'll explain.
The GOAT FM. We're Gainesville, Ocala's all talk.
Hey, this is Cynthia from Recharge Clinic. You need to come by this summer and get one of our amazing vitamin IVs. Dr. Tieche has made a great cocktail that's going to help you have more energy, lose weight, a better libido, and even sleep better. Come see us at Recharge Clinic, 47 Southwest 17th Street in Ocala, Florida. RechargeOcalaClinic.com. That's RechargeOcalaClinic.com.
Hello guys, this is Dr. Steve Tieche from Recharge Clinic in Ocala. Guys, it's very common to have erectile dysfunction, also known as ED. About 50% of men, even as young as those in their 20s, experience this. Do you experience low energy, low libido, and difficulty losing weight? Don't be embarrassed, just get help and start feeling like $1 million again. Check out my website, rechargeocalaclinic.com, or call my office to get started, 352-512-9996, to start feeling great again.
Hi, this is Lauren Gibson from Lauren Gibson State Farm here in Ocala. During this tax season, I would like to remind you to make sure you have properly insured your assets. Do you have enough liability coverage if you were to be sued due to an auto accident? Is your home insured to replacement cost or current value? If you don't know the answers to these questions, let Lauren Gibson State Farm evaluate your coverage. Call us at 352-355-3340.
BJ Trophies, so much more than just trophies. Now offering in-house production of decals, signs, and banners. Let them put your logo or design on almost anything. BJ Trophies also has traditional wedding, baby, and anniversary gifts, plus custom 3D crystal pieces, jewelry, and engraving. BJ Trophies making one-of-a-kind awards for your one-of-a-kind events for over 30 years. Don't forget, BJ Trophies now offers banners and decals for your business. Stop by BJ Trophies on Northeast Jacksonville Road or call them at 732-2249. That's 732-2249 or online at bjtrophies.com.
Document Technologies has been helping Ocala business owners save money on their copiers and printers for more than 7 years. Now they've added the full line of award-winning color copiers and printers from CopyStar. CopyStar has a reputation for their overall low cost of ownership and unmatched reliability. Combine that with Document Technologies' fast local service and 5-year guarantee, you have a combination that can't be beat. Plus, they have special programs for nonprofit organizations and government programs. To find out more about how Document Technologies and CopyStar's award-winning color products can help your business, call Bill Schroeder at 352-368-6664 and start saving today. We use Document Technologies, and so should you. Call 352-368-6664.
And in Gainesville at 372-6666.
Document Technologies, the only copier company you'll ever need.
You cannot ignore Facebook. Facebook live streaming.
The GOAT FM.
And we're back. Cynthia Tieche with Dr. Tieche. We were just talking about neuromodulators, those lines in your head, your forehead, and your glabella, and your crow's feet. How the heck do you get rid of them?
Yep. So neuromodulators are a class of substances that help relax muscle, and they're actually made from botulism toxin. And what it does is it weakly relaxes muscle. So there's really two types. Everyone has probably heard of Botox, and they were the first one to come out, and they've done a terrific job of branding themselves. It's really much like Coke, you know. So when people talk about neuromodulators, they always go, "Oh, I want some Botox. I want some Botox," not necessarily knowing that there's really 3 different types of them. But Botox was the first, and that's what most people are familiar with. But there's also Dysport and Xeomin, and both of those other ones work very similarly to that. And what they do is you put a small amount into the area that is contracting quite a bit in those muscles, and it helps just relax those muscles. And it takes several days. It does not work instantly. Really, most of them peak in about a week. And they say that its full effect is 2 weeks, but honestly, we see most of people's effect in a week. And what happens is those muscles just start to relax, and so therefore you get rid of those wrinkles, and the skin becomes smooth underneath it on your forehead and in this area here, and you're not really able to scowl down. And then on the crow's feet as well, that's really from this orbicularis muscle contracting down and causing that skin to fold on itself. So you also help relax that a bit. So you give yourself what most people describe as you look more refreshed, more rested after you've had it done, like you've gotten a good a good amount of sleep. And it's not painful, really. It's very, they are injections, but they're very teeny little needles. I mean, it's an insulin syringe, and the amount that you put in there is minuscule. And so it's very potent stuff, and it typically lasts about, anywhere from 4 to 6 months, depending on the person. And so it's very effective.
Can they be used for arthritis? I'm not sure if that's for the Dysport treatment or. But talk about what else Dysport and Botox can be used for, though. It's not just.
So it's used for other things other than wrinkles. So it's used for TMJ, and it's used for masseter muscle spasms. So there's people that clench their teeth quite a bit, and they just grind their teeth, or they just bite down a lot, and their masseter muscle is the muscle on their jaw gets very large, or we could say hypertrophied. And what happens is that aggravates the temporomandibular joint, and it almost causes like a little arthritis in there. So what happens is they have a lot of jaw pain, and then the other thing they subsequently end up having is a lot of headaches, because that muscle is very interrelated to the muscles on the side of your scalp. And so one of the things that happens is people initially will try things like bite blocks or stuff like that to help stop them from clenching. But one of the things that is also used is low dose neuromodulators into that muscle, and it helps just weaken it up a little bit. It's not to the point that you can't chew or talk or anything like that. It's not even that, but it's enough to just stop that really tight muscle, as well as to help with the headaches. And it works very effectively. The other thing that it's also used for is headaches, tension headaches. And so people who have tension headaches feel like they have a tight band on their head, and that's because the muscle around their scalp is constantly contracting down, and it actually feels like a vice. And so everyone's had these tension headaches, and they know what they're like, but people who have them in an inordinate amount of time, you can use it, to treat with those neuromodulators as well, and it will help relax that muscle a bit and stop causing those headaches to be so severe. Now, the other thing that's also used for is muscle spasms. It was used for things like called torticollis and things like that, where people had just, persistent muscle spasms that just stayed that way, and it would help relax that muscle. And so it's used for other things like that in medicine.
But not arthritis or anything?
Not typically, because it's not going to really help a joint per se. It's going to help the muscle, over that. So I don't think it really would help the joint.
I have a question from someone about spider veins. She said, why do they hurt? And how does the treatment work? Does it, dissolve in the vein? And if you do fix spider veins, are they going to continue to hurt? But let's start with, why do they hurt? And is that a spider vein or a varicose vein?
No, it can be. So spider veins are really skin manifestations of, they're dilated skin veins is really what they are. Now, what is the cause of them? That's really the main question. So in some people, so it really goes down a two path of really of whether there's a problem or cosmetic. And so let's go with the ones that are just cosmetic. So they have no underlying problem. There's no problem with the veins underneath. There's no blockages, no nothing. And theirs are primarily due to an embryological problem that they had. And so it's mostly hereditary, and they have this scattering of these skin veins over their legs. Now, typically, they're much worse in fair-skinned people because you can just see the veins a little bit more. In females, they predominantly congregate on the inner and outer aspect of their thigh, and that's where most people get them. Most women get them is in that area. They are painful as they get larger because they get full of blood, and so they sort of throb a little bit, and the blood that's in them gets a little bit stagnant, so it aches. That's spider veins. That's spider veins that don't have an underlying problem. Ones that do have an underlying problem can have, a vein obstruction underneath, or they could have what's called venous reflux, where the veins are leaking underneath, and now there's backup pressure on the skin veins. If that's the case, sometimes people have spider veins initially, and then they may eventually develop varicose veins. Those veins tend to actually hurt a little bit more, just because they tend to be a little bit more full. And so when they're full of the blood, that blood's not recirculating around, so they tend to ache a little bit more. Now, just because you have an underlying problem doesn't necessarily mean that those spider veins can't be treated and all of that. It just really each is a case-by-case basis of being evaluated. Now, treating. Well, the way they're treated is there's a couple ways that they're treated. Some lasers have come and gone with that as far as using lasers to treat them. And basically the principle of that is that it generates heat within the vein and really almost kind of boils the blood a little bit and damages the inner lining of that vein and causes them to stick shut. It's not really one of my favorite treatments. I've been treating veins for 10 years and I've used lasers several times. It's very painful to people, and I don't think the results are that great. You usually require multiple treatments. They don't go away with one treatment. So that's laser treatment. The most common treatment is what's called sclerotherapy.
And that's what we do.
And that's what we do. And sclerotherapy is an injection of a sclerosing agent. That's where the sclero came from. And a sclerosing agent is basically an irritant to the inner lining of the vein. So throughout time, there's been different medications that have come along. Most people think of saline. They've heard of saline injections. That was one of the first things that came out. It was called hypertonic saline. It was a very strong salt solution that was put into the veins. And then throughout time, there's been a bunch of different ones. The current medication that is really most popular now to use is called polydocanol, and it's in the classifications of detergents. It's not a detergent like Tide or Dawn, but it's a medical kind of thing. And it is an irritant to those veins. And when it's put inside the vein, it causes the veins to be irritated. Veins are very sensitive, and it causes them to stick shut. It doesn't do anything with the blood in the vein. It just has to do with the vein itself. It causes them to close. So that's the premise of it. Now, the problem is on very, very small veins, one treatment usually makes them go away. On veins that are a little bit larger of the spider veins, they generally require multiple treatments to make them go away. So those treatments are usually spaced out about 6 weeks apart, just because the first ones will cause them to fade, and each subsequent treatment will cause them to fade a little bit more. So, so it's frustrating for people because they want them to go away instantly. But the flip side is most people have had them for their whole life. So now, that being said, after you've done all of the treatments and their legs are clear, will they come back? Well, those veins that are treated typically don't come back. But if you have that predisposition, yes, they probably will come back. Now, the thing to remember is they're not going to come back in 1 year the way they were prior to the treatment. If you've been someone who's been getting maintenance treatment, in other words, every several years, 3 or 4 years, getting some sclero done, then they're probably just going to be a scattered few that need to be treated. If you wait another 20 years, then they probably will be bad again. So it's that kind of a thing. Most people have kind of let them get to the point where they're really sick of them, and they're usually the worst at that point. And then they get their treatment. So by kind of doing regular maintenance on them as they start to come in, it's a little bit easier to get them under control. So I hope that's what answered that question.
And if you're not sure what type of vein you have, if it's more cosmetic or you have any other issues, he will see you and take a look and let you know if sclerotherapy is for you, or if maybe you need
a further workup. Yeah.
And we have people that will send you to for that. I have someone that asked, who's watching today, that asked, family members suffer from genospasms in their chin, the involuntary chin quivers. Would Botox or Dysport be able to slow that down, that involuntary chin?
I would think that it would, because it's used quite commonly for people who hold that muscle very tight and always have like an orange peel effect on their chin, and they find that very bothersome. So I would imagine that it probably does.
It's worth a try. It can't hurt
Absolutely.
anything, probably.
Yeah.
So, okay. Cool. Good answer. Did you have some information on some salt that you want to talk about today?
Yes. So one of my little topics of nutrition is I wanted to bring up was different types of salt, because it is such a commonly used essential element really to cooking and in our diet. And so I wanted to look into it because, we all are familiar with just our white table salt and just saying, okay, well, is that all there is? And what types of salts are there available? Because, if you go into a gourmet restaurant, you'll see black salt and pink salt and all different kinds. And really, what's the deal with them? So I just threw out a couple of little stuff, a couple of kind of just trivia stuff that I found when I was researching it. So, salt has been used in our diet and has been used as a commodity since 6000 BC. So that's how long it's been around. And it was primarily used as a form of currency for many cultures. And the reason being is because people recognized it was very important to their diet, and it was a very scarce commodity in most countries. So only the coastal people right next to the desert knew how to make it, and so it became a currency like gold. And so what happened, it was so valuable that there's a lot of our current words that come from salt. And so one of the most common words is salary. That comes from the word salt. Yes, because that's how people were paid in Roman times. They were given special salt rations to the Russian soldiers that was called salarium argentum, and that's where that salt word came from. Another word that's derived from salt is salad, and that came from that as well. And so one of the things that's just some other things, just scattered little tidbits, is there's lots of phrases that are used to have salt, and where did they come from? Well, there's about 30 references in the Bible to salt, and such things as salt of the earth and salvation. Those are all based on salt, and really because it's talking about people coming from salt. And then really the other expression that people have used is they're not worth his salt. People say he's not worth his salt, and that expression came from Greek times when people were buying slaves, and they would buy them with salt. And so if they paid a certain amount for salt, a slave with salt, and they didn't pan out, they were not a good slave or whatever the problem was, that's where that expression came, say, oh, they're not worth their salt. So I thought that was kind of a cool expression. In many cultures, salt is a form of hospitality. And when you go to certain people's houses, they will offer you salt and bread as a way of being hospitable. So, it's very important. Salt is very important to animals, plants, and humans. Historically, one of the other things that salt was used for was it was used as a preservative. And so really, back in the 15, 17, 1800s, that's how things were preserved. Everything was kind of coated in salt, and really there was no bacteria that grew. So that was another thing that salt was used for. Another little tradition, there was salt, people threw salt over their shoulder, and that was meant to ward off evil spirits. And sumo wrestlers, that's another thing, when they get ready to wrestle, you'll see them throw salt into the middle of the ring before they start. And that's another thing that is just another old wives' tale a superstition thing that they used. Now, so the type of salt that I wanted to talk about was, because we had gotten a bit of Himalayan salt. And Himalayan salt, if anyone's ever seen it, is pink salt. And it comes from really the salt mines of Pakistan. And these things, it is about 5,000 feet underground, and it's been mined for centuries, and it is the purest form of salt. It is so far down that it dates back to prehistoric times, really back to 6,000 BC or something. Really the time when they first started mining salt. And so it is of the purest quality of salt. And so if people have the opportunity to eat that salt over regular salt, it's much more preferable. The other reason why is there's really no contaminants, because this salt has been buried, compressed, and had no exposure from the outside world at all. And it's pretty cool if you were to Google Himalayan salt mines and see how it's mined, because these things are giant caverns of this pink salt. And it's really beautiful, honestly. And what they do is they take out big slabs of it, which they use for cooking and things like that. Remember, we had a person that cooked for us on a salt slab. And basically, what she did was you heated up this Himalayan salt slab and prepared a meal on it. The converse is true. You can freeze them and put stuff on them. And so the food absorbs some of that salt and gives it a nice flavor.
It was so good. So she came in, it was like a little salt block buffet. A couple of them were like 500 degrees, I think. And so almost like when you go to the fondue and you have your meat and you have your fruit and whatever, you stick it in the boiling water or whatever it is. Well, this, you would just stick your meat right on the salt block. You didn't need any seasoning. It tasted so good because it got that seasoning from the salt. And then she had ice cream and watermelon, and I'm trying to think of what else, that you would stick on the frozen one. And it was just strawberries. And it just had amazing flavor. It was so cool. I was like, we need to have a bunch of these and have a little salt block. Party.
No, it was really cool.
It was really good.
So that was one of the things that made me start wanting to look up this salt and the Himalayan salt. And honestly, Himalayan salt it's really not that expensive to buy. It's about the same as really regular salt. and it has about 80 minerals in it. So it's a very well balanced salt. The next closest salt for being balanced with all of the trace minerals is what kind of salt?
Black salt? I don't know.
No.
What?
Celtic salt that comes off the coast
How
of
was I
Ireland.
supposed to know that?
I knew you wouldn't.
Oh,
Yeah.
okay.
It's off the coast of Ireland. And so I always thought that salt came from salt water. And in some countries, that's traditionally where it's made, and some places where I figure they just let salt water evaporate. And that's how a lot of salt is made. In the U.S., most of the salt that we get is not made that way. It is made by a chemical reaction, and most of it is bleached and has other stuff in it.
Why do we have that salt like that? That
Yeah.
white crap?
Because I
chemical
think
salt?
that people wanted it to seem clean and all of that. And so, although it tastes salty, it is probably the least nutritious salt for you. If you could find a salt and say, well, the salt is nutritious or not, it's the least nutritious, and it's probably has more contaminants in it. So even taking salt that comes from the ocean, you really don't want that so much now because the oceans are contaminated. So unless it's been really purified, you're not only going to get sort of this balance of salt, you're going to get some of this other crap that's in there. That's why this Himalayan salt is so cool, is because it's pretty much been protected from any outside intrusion. These caves are 5,000 feet underground. It's mined by hand. It's mined a certain way. It's been mined by centuries. Only certain people know how to mine it. They just don't go down there with machines. It's mined by hand. They mine it a certain way. They were pretty cool in how they came up with doing it. I mean, it was pretty ancient times how they knew not to dig too much so these caves wouldn't collapse. I was going to say about that.
Well, what about people with high blood pressure? So
the thing is, so the thing about this salt is it's got a lot of protective effects compared to just so traditional salt is just sodium chloride. Well, this one has got sodium, potassium, it's got all these other things. And yes, salt in excess can be a problem for many. It doesn't matter if it's Himalayan salt, Celtic salt, or table salt. But those salts are actually much better. And so, within the recommended amounts per day, it's way better. And this salt has actually been shown to have a beneficial effects on respiratory system. So one of the things is some people take, you've seen them become pretty popular, these Himalayan salt lamps that people are putting in their house.
Yes.
They're supposedly absorbing impurities in the air and absorbing moisture and stuff and helping to cure the air. But people have taken it one step further and built rooms out of this Himalayan salt that you sit in, and they're supposed to help detoxify your lungs, and they help your respiratory system, this Himalayan salt. So it's pretty cool. What else does it do?
That is pretty cool, to sit in the salt room.
Yeah. Actually,
that's a lot of salt.
Mm-hmm. Mm-hmm. So it really does help it helps reduce cramps, lower... it actually helps vascular health, lowers sinus
just by
problems.
Putting it on your food?
Yeah.
What's the recommended dose per day that you should be having?
I don't know the micrograms.
But is there any
danger?
danger?
Anyway, between the normal diet is 2,000 milligrams of sodium per day. So, so even with a higher sodium amount with Himalayan salt, people still slept better and had fewer nighttime awakenings. So it's a natural sleep aid.
Wow.
Air purifier, helps with digestion.
So those salt lamps aren't crazy. Get a salt lamp.
No, and it helps balance your body's pH and it helps treat respiratory stuff. So that's what I thought was kind of a cool little thing about salt, and that, we all use it every day and we don't really pay much attention to it. So maybe you'll think about your salt a little bit.
Yeah. Start
and
carrying
maybe you'll be worth your salt.
You'll be worth your salt.
Mm-hmm.
Worth your weight in salt. Yeah. Start carrying around a block of Himalayan salt. When you go to the restaurants, they don't have it.
No, but they have shakers of it now. That's how they do sell it. Some of them, when you look on...
Really?
Yeah. If you look at websites that sell them, they will sell them in blocks, and you can get like a little grater.
Get out.
Like when you go to get a pedicure, the stuff that they grate the cheese off your feet with.
That is gross.
I know. I'm just joking.
Stop it.
But they do have those things to grate salt. But you have grinders, and it comes in, you can get it in flakes, you can get it in chunks that you can put it in your own grinder, or you can get it in, finely ground, like table salt.
Is there any way that it's supposed to be better than another way?
No.
No? Whatever your preference is.
It's great for cooking and whatever.
Okay.
Bathing in it is good too.
Oh, yeah, okay. Just rub it around like a...
Just everything. Do everything with that salt.
Eat it, lay in it, sleep in it, put
sleep
it on
in
your
it.
walls?
Yeah, pretty much.
Okay.
So that's my contribution of salt.
Okay, good. So we had some patients come in with some interesting stories that you told me.
So we had a couple of interesting people come in, that have had some interesting problems that...
Honestly, it's interesting, but it's typical.
It is typical.
Unfortunately.
So I'm going to talk about two different hormone problems. One's a thyroid problem. So this patient had a history of thyroid problems, actually being hyperthyroid. In other words, their thyroid was too high, and actually even had thyroid cancer and had their thyroid removed. So as what would happen at that point, you have no functioning thyroid at all, and that patient was put on Synthroid, which is the synthetic form of thyroid hormone, which is T4. And that patient felt pretty good for a while, and then during their follow-ups, started feeling progressively worse, much more fatigue, starting to experience hair loss, and since the surgery, kept gaining about 5 pounds a day.
And we will come back to that interesting story.
The GOAT FM.
Has your doctor asked you to get an MRI scan? Have them refer you to Gainesville Highfield MRI. Why? Because they have a claustrophobic-friendly, large, short-bore, state-of-the-art high-field magnet that produces high-resolution images with lightning-fast turnaround time, often within 24 hours. They offer same-day scheduling, and their facility is claustrophobic-friendly, with scan times averaging just 10 to 15 minutes. Gainesville Highfield MRI has been around for over 20 years and performed over 50,000 scans, and they accept most major insurance. Learn more at GainesvilleHighfieldMRI.com.
Hi, this is Cynthia from Recharge Clinic. If you are struggling at all with your weight loss, you need to come in and see us. 47 Southwest 17th Street in Ocala, Florida. Check out our website, rechargeocalaclinic.com. That's rechargeocalaclinic.com. rechargeocalaclinic.com. We can help you. We will get you through whatever weight loss struggle you are facing.
It's going to happen to all of us. It is the one insurance we can guarantee there will be a claim on. So the question becomes, will your family have enough money to pay for their mortgage, for their food, or their education? Or will they have to borrow money and struggle? Lauren Gibson State Farm has a solution for every situation and can help get you protected today. Take care of your loved ones and take the worry off your mind. Please visit our website, insuredbylauren.com, or call us at 352-355-3340.
Hey, this is Cynthia from Recharge Clinic. Guys, are you ready to feel like you're in your prime again? Dr. Tieche is Ocala's leading medical doctor treating you for hormone replacement, weight loss, vitamin infusions, and more. You can feel confident that you are being treated by an experienced, knowledgeable, caring physician. Come see us, 47 Southwest 17th Street, Ocala, or give us a call, 352-512-9996.
Not only does Triple Crown manufacture trailers, but they also service and repair all makes right at their facility. From boat trailers to enclosed trailers and everything in between. So challenge Triple Crown with your bearing job, rewiring, welding repairs, gate addition, hitch installation, or accessory. They're happy to help you service all trailers at Triple Crown Trailers. Call them today at 352-368-7885. That's 352-368-7885. And speak to their knowledgeable service staff to schedule your next appointment. Or stop by and visit Triple Crown's 2,100 square foot parts showroom at 4251 South Pine Avenue in Ocala. You can count on Triple Crown Trailers for quality service when you need it.
Gainesville, Ocala, all time. The GOAT FM.
Cynthia Tieche here with good old Dr. Tieche. We were just discussing some thyroid issues that a patient had. We'll finish up with that.
So I'll finish that one up. It was pretty interesting. Anyway, the lady was having a lot of symptoms and went back to their doctor, and they said, your T4 is in the normal range. Everything's good. We really can't do much. came to me. We did some basic labs, which we did the complete thyroid profile, which is a TSH, T4, and T3. T3 is the breakdown product of T4, which is the active form, was incredibly low. I mean, basically almost off the charts low. So, that's really what was going on. The person, from the stress of the surgery and all this treatment, developed an enzyme problem there, and that was not converting. So they were having full symptoms of low thyroid. So we put them on thyroid medication, dramatic turnaround. Another patient we had who was a young man who was feeling bad, crappy, no energy, weight gain, just mental fog, was been followed by their primary for 2 years. No, everything's fine. Testosterone level 300. We see this over and over again where people are struggling with this, and started on testosterone therapy and really had a dramatic turnaround as far as energy level, motivation, starting to want to work out again. So that's good.
Yeah, it's pretty common. I mean, most people, literally every day when I talk to people in the consultation and I say, well, that could be a thyroid issue, they say, every single one, I just had my thyroid panel, they said everything's fine, but they only are looking at the TSH. I don't understand why, but if your doctor didn't look at T3, then, and they probably won't, they won't look at it.
If someone's told you your thyroid's normal and you have those symptoms that you feel like you have low thyroid, you probably do. And so really get someone else to take a look.
But there's a big puzzle. It's, testosterone is good, thyroid is good, but there's other things. There's vitamins, there's adrenal. There is a lot going on. So to go to someone who only wants to treat a very small piece of what's really going on is really not doing you any favors. Mm-hmm. So unfortunately, that's what's happening.
So you being a personal trainer, you probably know about this.
What?
This is a thing that happens. And I don't know if you've ever heard of this. Have you ever heard of a coregasm?
Yes, I have.
What is it?
So this is the one you wouldn't tell me about. You wanted to throw me off today.
So a coregasm is an exercise.
I thought you wanted me to explain.
Well, I do want to explain.
Oh, okay. So basically, just I'll say it as professionally as I can. It's an exercise-induced orgasm.
Correct.
But mainly in women, right?
It's mainly in women, but men get it as well.
But you don't hear about it a lot because no one wants to ever say that
happened.
happened.
No one wants to talk about it. And in fact, most people.
But it's real.
Most people
Good
avoid.
topic. That's
most
good.
people will avoid the exercise. So typically, it is much more common in women than in men. Women, it feels like a deep vaginal orgasm, whatever that feels like, and in men, it feels like a prostate orgasm, whatever that is. Anyway, that's what it says.
So you said coregasm because it really does have to do with when they're working core.
Core exercise.
But how does that happen for men?
So men happen when they're doing sit-ups, crunches, leg raises. That's one of the things that happens, and squats. Interestingly, for women, it happens when they're doing leg raises, like hanging leg raises and abdominal exercises, things like that. And so what happens is anytime an exercise is used to stabilize the core, and there's movement in the pelvic floor, it increases blood flow to that area and can cause that. So there's really two words, other words that are used in the literature, because this has been recognized since 1952. This is the first time it was reported. And they're called two different things: exercise-induced orgasm, or EIO, or exercise-induced sexual pleasure, EISP. I personally have never experienced it, so I don't know. Anyway.
I was going to ask you something. Is there any certain type of people that experience it more than others, or it's just totally random for no reason that this person does and that person doesn't?
Oh, I think the people that tend to have it are much more prone to it, and they just seem to be more sensitive, and typically they won't do those exercises because it could be embarrassing for them.
Or they have extremely rock-hard abs and a six-pack all the time. Because they're doing them all the time.
Yes, it could be, yes. And they're over there, enjoying themselves quite a bit.
Yeah, I mean, who would have thunk it? You could have an orgasm while you're doing your ab workout.
While you're working out, yes.
Yeah,
So that's a motivation.
Hey. Yeah, so everyone go home and just work your core like never before tonight.
And let us know. Let us know if it works. If you have a coregasm.
Yes. So let's repeat what exercises may induce this.
Mostly lower abdominal exercises. That's really what it is.
So leg lifts.
Leg lifts, leg raises, crunches, Hanging leg raises is the most common one for women. So when you see women on that hanging leg raiser machine, I give them a little, they might have a little smirk on their face. So you might notice that machine's got a lot of extra interest.
I'll be honest with you. I never brought my female clients to that for that reason.
Mm-hmm.
I was just saving them the embarrassment.
Mm-hmm.
But for people who don't know about it,
yeah.
So there's no science behind, like, is it the way their hips are moving?
It just says it's thought to be from increased blood flow to their pelvis, and just happens to stimulate those organs in a certain way. I guess it's pretty sufficiently vague, but it's definitely well recognized. I mean, it's been recognized since the 50s, so it's not like there's only a couple people that have had it, so it must be pretty common.
Yeah. So everyone, their abs will be sore over the next few days because everyone's going to be trying this.
Yeah, I hope so.
You know what? That's our weight loss tip for the day.
Yes.
Find out, are you this person
that can have a corgasm?
Can have a corgasm.
Yep.
Are you this lucky person? Yeah. They're probably doing abs right now.
Yeah, exactly.
Then
all of a sudden, everyone's sitting up or hanging. Yeah.
Yeah. So the hanging ones.
The hanging ones from
And then the laying leg lifts.
Mm-hmm.
No, that's it. Was that was your big thing you want to talk about today?
I thought that was a pretty good one.
Yeah, that's good. Okay, so anything else that you want to add? I'm going to talk about like us cookie monsters. I had an idea and I texted you and you did not answer me. So I'm just going to ask you on here. So, I love going to my Christmas cookie exchanges, right?
Yes,
What?
I do know that.
Okay, yeah. But I was thinking about doing a Christmas keto cookie exchange, or keto cookie exchange. What do you think? Do you think that's a good idea?
Cool. Yeah. Who's going to be involved in it?
What do you mean?
Who's going to do it?
Honestly, like deep down inside, the reason I thought of this was because I'm trying to eat ketosis, and I really want someone to make me some keto cookies.
So you want someone to really make you some keto cookies?
So I thought I'll be the judge that night, and I.
But then you're talking about Christmas cookies. It's only August.
Well, I went to Hobby Lobby the other day, and I got a little excited about Christmas and all.
So if someone wants, basically what she's saying, if someone wants to practice making some keto cookies for Christmas,
you should practice now to get ready for the party. If you are interested in coming to my Christmas keto cookie exchange, message me because I'm probably gonna have one.
Okay.
And I'm gonna have it at Recharge.
Okay. Are you gonna have eggnog?
Is that keto? No. There's probably a lot of sugar in there.
There probably is, but maybe there's got to be a keto form of eggnog. It seems like it's pretty fat filled.
High fat, yeah. You could probably make it with something.
We know we can have coffee, so that's good.
Yeah, but it doesn't have to just be keto cookies. It could be any keto dessert. And so I'll be sitting there like a fat cow eating all of the cookies
but the
and
thing
judging
is,
them.
you'll be losing more weight as you eat. So
Yes.
actually, the more you eat, the more you'll
Yes.
lose.
Yeah.
Yeah.
So I am. I'm going to have a keto cookie exchange. Maybe I'll have one in November. Maybe I'll have one in October. Wait, where?
Yeah, you can have a Halloween one.
Oh, yeah.
You can have a Halloween cookie one, then you can have a Thanksgiving one.
But I looked it up. There are a lot of keto recipes now for cookies and desserts and breads and all kinds of junk. So it tastes good. I made keto cheesecake the other day. That tasted good.
It was pretty good.
It was straight up. It was no carbs. It was cream cheese, grass-fed cream cheese, grass-fed butter.
Well, basically, it was cream cheese without the crust. That's really what it was.
You mean cheesecake?
I mean cheesecake without the crust.
Yeah, there was no crust. Well, no, I think you put sugar in some cheesecake because I put a sugar substitute in there.
But there was no crust.
There's very good sugar substitutes that you can get that are not bad for you. But yeah, so I put, and then lemon extract. So a tiny bit of lemon extract in that whole thing, that probably has sugar, but that was 1 teaspoon for a whole huge batch of cheesecake. So it was really like no carbs in there. And it was good, don't you think? Mm-hmm. Were you lying? Did you like it?
I liked it. I did.
You better
I would
say
never
you did.
lie about your cooking.
Well, I don't cook much, so not much to lie about. All right, so rechargeocalaclinic.com. Message me if you want to come to my keto cookie exchange, or if you just want to make me some keto cookies, I will accept them. You would too, wouldn't you?
Oh, yeah.
Dr. Tieche loves food, so anytime you bring him food, he's going to be pretty happy. So
I have a food issue.
he has a food issue, but we're working on that. but he's doing really good, working out in the gym every day. All right, so every Thursday, 3 p.m., we're going to be live on the radio, Facebook Live, and make sure you join us and share this on your page and tell your friends. And come August 25th, come to our open house. Stop by the clinic. We always offer free consultations. You cannot miss our clinic. It's the blue Recharge logo, right?
It is the blue one.
The blue one. Come by anytime you're driving by. People always say, I always drive by and see you guys. I'm like, well, pull in. You don't have to have an appointment. We like appointments, but if you just want to come by and say hi and see what's going on, you're welcome to do that. Definitely come by. Anything you want to add before we close up today? When we close up shop?
I think you summarized it all.
Everyone go home, get your ab workouts in, and check out our rechargeable page. We have a Facebook page that we organize like walks and jogs at Jervy Gant. So if you want to join, but on that rechargeable page, we share a lot of keto recipes. So check it out. All right. We still have 1 more minute. I was thinking we were done at 3:54. Okay. So we actually have a special. This is perfect because I forgot to talk about my special. We have a special right now for teachers. It is all the month of August. They get half off their vitamin shots. So in our open house, it's half off vitamin shots just for that open house time. But teachers are lucky, and we want to appreciate them and give them half off vitamin shots all month long. So if you're a teacher or you know a teacher, definitely come by because that saves you quite a bit of money. So a super fat burner shot is typically $35. You can get them for $17.50 if you come by and you're a teacher. Flash your badge. You have to have your badge. No fake teachers. All right. So we will see you next week. Thanks for joining. Hey, this is Cynthia from Recharge Clinic. Come see Dr. Tieche at the clinic to get recharged. Offering testosterone therapy for men and women, vitamin infusions, fat burning shots, weight loss, and more. 47 Southwest 17th Street, Ocala, Florida. 352-512-9996.